Hi, I'm Amanda from Sullivan 180, and I'm very excited to bring today's Take 5 video series to you. Dr. Cecilia Escarra is originally from Buenos Aires, Argentina, and holds a master's degree in health administration. She became an orthodontist and also has expertise in medical auditing. Dr. Escarra arrived at PRASAD in 2002 to work as administrator of the PRASAD Children's Dental Health Program in New York State. In 2012, she was appointed executive director of the PRASAD project, and under her leadership, the PRASAD Children's Dental Health Program has received numerous awards from the state and national entities. PRASAD's work has been recognized on the national and the international level through publications. And Dr. Escarra, we are extremely happy to have you today on a Take 5 for Children's Dental Health Month. First question I'm going to ask you, how have things changed for PRASAD since the start of the pandemic, and what challenges have you faced?
The pandemic is affecting everybody everywhere, including our dental program. So we went through different phases. The first one was in March when we had the lockdown and all the dental offices, most dental offices in our program was closed. However, we maintained a hotline. That was really useful, Amanda, because parents had children with pain. They didn't know who to call. They were not answering the phone. So our staff was helping them, referring them, sometimes even to the hospital, because some cases they have infections, so they need to get care. And the good news were in July, we followed the CDC and ADA strict infection control guidelines. And we opened our dental clinic in Ferndale, New York. We are very close to Sullivan 180 headquarters. Mm-hmm. And since then, we have been seeing patients. It's a very safe environment for our staff and patients. And we follow all the protocols that probably you have go through when you go to your doctor, right? We ask the questions, you wait in the car, we take your temperature, and we take all the time to clean between patients. And of course, there is new equipment, probably you have seen, all the coverage for the dentist and also to protect the patients. The difference from previous year, the main difference is so far we are not going to the schools this year because the New York State Department of Health does not allow programs to operate at the schools, and makes sense, right? Because we know how challenging is the schedule, right, with the schools and infections. So that's why we still are providing services in Ferndale and promoting the service throughout the schools. So that's the way we have been affecting, and also financially, because we can see less patients, everybody, right? Because you need more time, but also less revenues, and we are a non-profit. So that's why it's challenging, but we are committed to continue serving the children in Sullivan County for
I'm so glad that you are. We all know how important it is. And, I've been amazed to see the difference in my own dentist, how things have changed. And why is it so important that we all continue to go to the dentist and not put off our dental care during this pandemic?
Yeah, it's really crucial, because if you don't have good oral health, you don't have health. The teeth are part of your body. And research shows many diseases are linked to poor oral health, like heart diseases. And sometimes it's silent. And then you have great consequences in your health. That's for the point of view of health. And a comment, I know we'll focus on children, but also for adults, I have read some research that dentists found out that adults have more issues, with stress. So their teeth are broken, so many things that you don't realize that the dentist can detect, and could be, early detection can save you,
How can parents make an appointment, get in touch with PRASAD, and make sure that their children's dental health, most importantly right now, is being taken care of?
Yeah, so February is really important month for our mission, because it's the opportunity to promote even more oral health. And we need to help families to support the children to develop good oral health habits, right? Because then extend your rest of your life. If you have bad teeth when you are a child, then you could have many problems when you are an adult. And plus we see, dental cavities affect children in so many ways. They cannot smile, they cannot eat, they cannot learn, they cannot play, and their self-esteem. So when they are adults, if you cannot smile, smiling is so important, right, Amanda? Because
absolutely,
when you smile, you show confidence and you connect. If I smile, you smile back to me, right? So that's why it's not just for the child, for the whole life. is the opportunity to develop good oral health habits. And for PRASAD, we used to provide dental health education at the school. Right now it's not possible, but we are exploring virtual education by recording a video and offering to the schools. We are working on this month, and also offering toothbrushes to the schools in February that they can distribute to the children, and hopefully to have also press releases and more media attention. And to make an appointment with PRASAD, you can call 434-0376 extension 1216 and to make an appointment. We have appointments available. We also take emergencies.
I love what you said about children's smiles. We are going to take off these masks someday, and we want to make sure that these smiles are ready for that day, and that they're well taken care of. And PRASAD certainly helps the county and helps the children do that. Anything else that you'd like to share?
So I want to say we are here, we are committed to serve our community, and we'll look forward to continue partnering with Sullivan 180. Really, it has been a pleasure to help families, with food during the holidays, and maybe many other exciting initiatives, Amanda, that we could do soon.
Sounds great. We are always a consummate partner for PRASAD. So happy Children's Dental Health Month, and thank you so much for being with us today, Dr. Escarra.
You're welcome. Happy Children's Dental Health Month, Amanda. Thank you.